All right, hello everyone. My name is Michael Brainerd. I'm a physical therapist here at the iSport facility. And today we're going to be talking about rotator cuff pathology and shoulder impingement, which are two of the more common causes of pain for the shoulder. All right, so in this video we're going to talk about how you can identify any of these conditions, and secondly, what you can do in terms of treatment for this kind of condition. I can also show you some tests that you can perform on yourself to see if you have it, and then we'll talk about different things in forms of what my recommendation to you would be. All right, let's dive on in. All right, so what is the rotator cuff, you might ask? So the rotator cuff muscle is a set of muscles that actually support and stabilize the shoulder. So what I got here in front of you guys is the right shoulder model. So the rotator cuff muscles are going to consist of four very important muscles. So the first one here in the back would be the supraspinatus muscle, and that's going to help bring the arm out to the side as so. And the infraspinatus muscle, which is this muscle right here, is going to help externally rotate the shoulder. All right. There's also another muscle known as the teres minor here, which will also externally rotate the shoulder. And then the subscapularis, which is this muscle as such, and that's going to bring the shoulder in with internal rotation. So collectively, these muscles, known as the sits muscles, are going to be very important with stabilizing and supporting the shoulder. Very important with our overhead athletes, people that use rackets with sports, even basketball players, anyone that's lifting their arm overhead. We even have workers that do painting. Anyone that's going to have any activity that's going to involve lifting or overhead activities may encounter issues with their rotator cuff muscles, okay? So another thing I want to talk to you guys about is shoulder impingement. So what shoulder impingement is, you have a certain amount of space around the shoulder joint, and with time there's the tendons of the rotator cuff that can degrade or fray, and that can kind of block the space that you have there. That can cause an impingement. You also have the bone here, which is known as the acromion. It can start to have growth that puts pressure or pinches the actual tendons in this area. So several things that can cause it, and this can be due to normal aging. It can be due to repetitive overhead activities, overhead throwing, and just lifting weights at the gym. There's a several list of causes that can actually contribute to this. All right, so now let's do 3 assessments that you can do on yourself to determine whether or not you have some shoulder pathology or impingement going on, okay? So the test that we can start off with is called the painful arc test. Basically what you'd be doing is you're bringing your arm all the way up to your side over your head, and you're going to determine if there's pain at a certain motion, typically between 60 to 120. So around this range right here is where, if you have pain, that's highlighting whether or not you have some impingement going on. So try out that test right now. There you go. Yep. So typically around this 60 to 120 range is where he would have pain. And that pain would be typically in the front and the outside part of the shoulder. Okay? The second test that you can do is the Hawkins-Kennedy test. So with that test, you're going to bring your shoulder up, and then with the other hand, you're going to rotate. We call this internal rotation, and that would also reproduce pain here. So shoulder at 90, internally rotate, and that would reproduce pain. All right, the last test that he can do now is just testing the strength of his external rotators. So arm at your side, your other hand reaching over here, and you're going to push into the hand that's not letting you move. So that's going to test your resistance in external rotation. So if you have pain or weakness with this, then that's highlighting the fact that there might be some rotator cuff tendinopathy or pathology going on. All right, so 3 assessments real quick that you can do to determine whether or not you have these things. Now what I'll do is I'll show you 4 exercises that you can do that are very basic, that are geared towards treating the shoulder impingement or the shoulder rotator cuff pathology. All right, and simple, all you need is a band. So you get the band, you put a knot here, and this knot is going to be an anchor when we use the door for all these exercises. You want to put it to the height just below your chest when we're putting it in the door here. All right, so the first exercise is going to be shoulder extension. So you're just bringing your arms down to your side as so. And I'll have you do this, Jonathan. All right. And you just want to make sure that you're not going too far behind your back, just going right here to your side. Very good. And we're engaging this muscle here, your latissimus dorsi, amongst other muscles, but are very important for stabilizing the shoulder as well. All right, the other exercise would be a row. So band still stays there, and now you're just going to row backwards. So that's a single arm row. And then you're doing a good job with that. You're not going too far back, your elbow's just there. And you want to focus on bringing your scapula or your shoulder blade back with this one, okay? Perfect. And now the other exercise would be rotation. So you can do internal rotation. So just by holding the band here, you're going to go straight down to your side. And this exercise would be best done with a towel roll underneath your arm, so that way it supports the better mechanics and reduces compensations when doing so. I'll see if I can get one right here. So towel rolls under here, it's nice and tucked, upright position, and you're going to go ahead and just go with internal rotation towards your body. Good. And the whole point of these exercises is you want to go more slow, more methodical, because you want to focus on the contraction of each of these exercises. You don't want to speed through it. It's not about the amount of weight. It's about getting the reps in. Typically, all these exercises, you can start off with 3 sets of 15 and rest between 30 seconds to 60 seconds in between each set, okay? The last one we got left is the external rotation. So just doing the opposite direction. So you can just go outwards in this direction. So before you were doing internal rotation, now you're doing external rotation. If you're going to be working the same arm, you'd be turning around to do the external rotation. But go ahead and show, for the camera's sake, external rotation, like so. This goes underneath. Yep, so you don't want to go too far out here. You want to go all the way in here, and then you want to go just to here. Yes. So that's a typical pattern that people might do, is they might go too far out into external rotation. Now you're not focusing or isolating the rotator cuff muscle during external rotation. You're doing other things there, which we don't want. But this form looks good now too. Perfect. All right. So we got 4 exercises, and this is going to be geared towards stabilizing, reinforcing the rotator cuff amongst other muscles of the shoulder. So this might be a basic exercise program that we give to you to do at home once we see that you're doing it correctly. When you come into the clinic, we're doing a lot more progressive exercises using all the equipment that we have here, amongst other things. All right, guys, so we showed you the anatomy, we showed you some self-assessment tests and several exercises that you can do that are basic. If you have shoulder pain, bottom line, come see us over at Physical Therapy and we'll help take care of you, and let's keep being pain-free.